If you're actually going to diagnose toxoplasmosis, then you are looking for shedding of oocysts. So it happens in the fecal sample. And the animals that are shedding, those are the ones that are a zoonotic risk. Those are the ones where we worry about them transmitting disease to people. And how long is that shedding period again? Couple of weeks. So usually between 1 and 3 weeks, on average 14 days. And so they are the ones within that realm of time of shedding that are a risk. If you have ill animals that you're worried about, they may not be shedding at that point. So they may have gotten disease earlier, or the toxoplasmosis is now causing disease in them, but they're not actually shedding. And so you can do blood tests on those guys to decide whether you have systemic illness. And what you're doing is an antibody titer. So you are looking for the body's response to the organism. Now, what's the problem with that? They may have been exposed a long time ago, and so they're just positive, and it's not a problem. Or they may have been exposed recently, and it is a problem. And those can be really hard to distinguish. And so one of the ways we do it, and this is, again, getting a little heady and scientific, but there is a way to break down your antibody test for more immediate antibodies. So IgMs occur pretty early in disease. IgGs are a sign of a more chronic disease. And just so you get a sense of it, if you're going to submit serology, you really want to look at both of these. Because if it's a more acute disease, your IgM is what's going to help you identify that and be like, okay, this disease is new. It probably is responsible for what's actually going on with this animal. I also use this because if I'm worried that what I'm seeing in a kitten or a cat may be toxoplasmosis, I can essentially rule it out if I get a negative serology in a lot of cases. If I don't have any toxos showing up, I feel a little bit better, and I don't have anything in the fecal sample, I feel a little bit better that that's off my list of differentials, and I need to deal with other things. They can absolutely remain positive for antibodies for life, just like we do. So once you test positive, you're going to be positive for life. And those cats are really a minimal zoonotic risk if they're not sick. So they're not shedding. They may have been exposed a long time ago, and if it's actually a positive serology, that is not a reason to consider that cat a risk. And this is a common error where people will say that cat is toxoplasma positive on serology, and now that cat is a threat. No, it's not. That is exposure, at least not as we've thought of it traditionally.